Here are some tips for caring for your child while they're in the Spica cast. For children who are not toilet trained, we can prevent skin breakdown with the following techniques. You will need a urinary incontinence pad, a small and a larger diaper. We have found that this 3-layered system, when consistently done, helps to prevent skin breakdown and maintain the integrity of the cast. Now we'll show you how to diaper. First, place the urinary incontinence pad in the genital area, tucking the pad snugly under the cast. It is not necessary to remove the tape off the pad. A feminine pad can be used, but it does not absorb as much urine. Then place a small diaper on top of the urinary continence pad. The diaper size depends on the size of the opening around the genital area. You want to use the smallest size that will cover the opening yet be able to tuck the edges under the cast. Be sure to tuck all sides of the diaper underneath the cast. Lastly, place a larger diaper over the cast to ensure privacy. Check the diaper every 2 hours during the day and 4 to 8 hours during the night. For children who are toilet trained and in a Spica cast with their hips flexed, you may hold them over the toilet and support them by holding the cast. Do not lift your child under their arms. A commode chair that fits over the toilet and has armrests will allow your child to assist with their support. With or without a commode chair, never leave your child unattended. Speak with our continuing care nurse to obtain a commode chair. Now we'll show you how to position a child in a Spica for comfort to prevent skin breakdown and pressure sores. Always lift your child by their cast, not under their arms. This side position shows how to support the upper limb. The child should be turned every 2 to 4 hours. Always support their head and legs with pillows. Check their toes and feet for warmth, movement, and color. Also, check their skin along the cast edges. When placing your child on their back, see how their legs are supported by pillows, allowing their heels to be off the bed. This view shows again how their feet can move freely. Here are a few things you want to look out for. Don't allow their heels to take the weight of their body. Do keep their heels off the bed by supporting their calves with pillows. If you can slide your hand under their heels, then there is no weight to cause a pressure sore to their heels. Don't allow your child's free-moving leg to hang against their cast. This will cause pressure to the nerves and blood vessels. Do support their unaffected leg with pillows. Also support their affected leg with small folded blankets to allow for free movement of their foot. Children over 1 year of age with good head control can lie on their belly. When turning, always turn your child towards you with a free leg up. Their back should be level or their head slightly higher than their back. Place pillows under their chest and legs to ensure safety and comfort. Be sure that your child can turn his or her head from side to side freely to prevent suffocation. Most children fall asleep easily in this position. Also see how their knees are not touching the bed. Here's another view of the belly position. Adjust pillows so that their knees do not carry the weight of the cast and allow for freedom of movement of the feet. This position is not advisable for children with poor head control. Your child does not have to stay in bed and would enjoy a change of scenery. They may be transferred to a go-kart or a wheelchair as your doctor orders. Again, position to support extremities and use a safety belt. If a safety belt is not available on the go-kart or other seats, such as a stroller or a wagon, be sure to stay with your child at all times. A rental wheelchair can be ordered if your child is more than 3 years old. A stroller or umbrella stroller would be best for those under age 3. Another possibility is a jogging stroller. You may use a beanbag chair at home, but remember to keep your child visible at all times as there are no safety belts. Bring in your car seat and try the fit before discharge. Often, a booster seat or a car seat with low or no sides works well. Other options are a car seat made for Spica, which costs $400 to $500, or an Easy-On vest. These car seat options can be reviewed with you and your nurse and the hospital's Injury Prevention Program representative. Here are some tips for caring for your child while they're in the Spica cast. Do not use anything to scratch their skin under the cast, as it could cause an abrasion. Do not use any oil-based lotions or powders on waterproofed lined casts. Try dressing small children and infants in a t-shirt or a onesie to prevent food from falling between their skin and the cast. Call your child's doctor or nurse if your child has any of the following: if your child's toes are very red or blue, cold, and/or swollen; if your child has any broken or very red skin, or any rashes or redness in the diaper area; if your child has numbness, tingling, or is not able to move their legs or toes; if the cast gets wet; if the cast has cracks, splits, or is getting soft; if the cast looks tight and the skin is swollen at the cast edges; if there is a bad smell or leaking from the cast; if your child has pain that does not get better with their pain medicine; if your child has a temperature higher than 101; if your child has unexplained fussiness or irritability; and if your child has any breathing problems. Here are some important numbers to keep in mind. If you need to call a doctor or a nurse between the hours of 8:30 in the morning till 4:30 in the afternoon, Monday through Friday, call the Orthopedic Ambulatory Clinic at 617-355-6021 and ask to speak with the triage nurse. If you need to call after 5 p.m. on weekdays or on weekends and holidays, call the page operator at 617-355-6369. Ask to page the orthopedic resident on call. Please feel free to share your new knowledge along with this DVD with other caregivers. This narrated PowerPoint presentation highlights several aspects of Spica cast care. It is not intended to replace the home care instruction sheet titled Home Care Instructions for Children and Adolescents in a Spica Cast. Please refer to the home care sheet for further details. Children's Hospital Boston does not endorse products mentioned on this DVD.